Welcome, my name is Peter Strong. I provide online therapy via Skype for the treatment of anxiety disorders, including agoraphobia. So if you're looking for teletherapy for agoraphobia, then I invite you to go to my website and learn more about the online therapy service that I offer. All my sessions are done via Skype. That is quite important. You must be able to see each other in order to have a successful psychotherapy experience. Being able to see each other means that the sessions will be much more effective in helping you learn how to work with your anxiety. So that's the primary focus of these teletherapy sessions. I will teach you very practical mindfulness-based methods that I have developed and found to be very effective for overcoming anxiety and panic attacks, and basically allowing you to recover from the very debilitating effects of agoraphobia. The primary method that I will teach you during the online sessions is called mindfulness-based exposure therapy. And this is where we design a series of exposures that might be quite simple to begin with and then progressively more difficult, that you then practice yourself at home between sessions. The mindfulness part of this practice is preparing before you do each challenge. So if it's, for example, walking to a local shop or going into a mall or even driving your car for a short period, then you basically will run through that challenge in your imagination. You will visualize doing that challenge and specifically look for any anxiety reactions that may occur. When you find those anxiety reactions, you then start to work with them using the methods of mindfulness therapy, which I will teach you during these sessions. But primarily the idea here is that you train yourself to recover, to heal those anxiety reactions before you do the exposure challenge. That's the important principle here. You have to train with that anxiety to neutralize it before you do the challenge. When you've done that, when you've neutralized that anxiety reaction, so you can imagine doing that challenge without feeling any anxiety, then when you do the exposure challenge, that will reinforce this new perception, this new way of processing the particular triggers that are associated with that challenge. So, for example, one person that I worked with for a few months was not able to leave the house at all. She could not leave the front door. The thought of that was completely overwhelming. The anxiety was totally preventing her stepping outside the front door. So the mindfulness-based exposure therapy is about having her imagine stepping outside the front door, whether it's 1 or 2 feet, it doesn't matter. But we design that challenge, we then imagine doing it, we look for that anxiety, and then we start to develop a mindful relationship with that anxiety that's based on compassion and is based on a very strong non-reactive relationship with the emotion itself. So the real problem is that when anxiety gets triggered, it tends to proliferate. It triggers more anxiety through reactive thoughts. And that simply feeds the anxiety, and it stops it from healing. But when you can sit with that anxiety and not react, then you're not feeding that anxiety, and it begins to diminish in intensity. The more that you can sit with it without reacting, the less intense it becomes. And when you've done this in a very focused way, by actually deliberately bringing your mindful attention to that anxiety, that rate of neutralizing the anxiety greatly increases. So this is what we do before we do the challenge. We work with the anxiety, learning to be with it without reacting, and learning to relate to that anxiety with compassion. That is, how can you help that anxiety feel more comfortable? You learn how to comfort the emotion in the same way that you might comfort a child, for example, that was afraid. How would you do that? You would establish a conscious, non-reactive relationship with the child. This is what we need to do internally. We need to establish this quality of a non-reactive, compassionate relationship with our anxiety. That is what will allow that anxiety to heal much more than any other methods, and certainly more than trying to struggle through the anxiety. That approach tends to reinforce the anxiety yet again, because it's providing evidence of how difficult it is to step outside the front door. We want to be able to imagine stepping outside the front door with no anxiety at all. Then when you do that, that now establishes a new experience that becomes learned and well established in the mind and in the brain as a new learned pathway, that stepping outside the front door is no longer a source of anxiety. And then you would move on to the next challenge, which might be walking to the street, and so on. So we work in this very focused and strategic way. This is what is called mindfulness-based exposure therapy. And it's very, very effective. It's much more effective than traditional exposure therapy. It's completely different than talk therapy in the conventional sense of trying to understand your anxiety and trying to convince yourself that you don't need to experience the anxiety, that it's irrational. That kind of approach, in my experience, is practically totally ineffective. What does work is when you gain the actual experience, first in the mind through imagination, imaginal exposure, if you like, and then in the actual exposure afterwards. That experience is what produces the changes. So if you'd like to learn more about teletherapy for agoraphobia and other anxiety disorders using Skype, then do please look at my website and contact me if you have any questions. We can schedule a Skype therapy session and you can see for yourself how this works. Most people see quite substantial improvements after the first 2 or 3 sessions. Once you start learning, applying the mindfulness approach that I will teach you, it's very, very effective. So please contact me if you would like to learn how to overcome your anxiety and apply this kind of methodology. Thank you.